The opioid crisis, a short epidemic of the 90s, or is it? The opioid crisis began in the late 1990s, being one of the most significant epidemics in the US history. The prescription of pain medication began with the crisis that not only stayed in the 90s, but it continues today as well. It is important to be aware of this crisis that can be so addicting if not administered correctly. And as fellow Americans, to be informed of what the consequences of taking them are. Opioids can really harm someone's health. The opioid crisis is an ongoing epidemic that has cost the lives of hundreds and thousands of Americans, and not just people in America, but people worldwide as well. Today, I will talk about what the opioid crisis is and its effect on Americans or people that use it. Secondly, I will talk about the timeline of this crisis from the 90s to today. And third, I will discuss the modern situation that's going on and how it's slowly advanced. Although the 90s opioid crisis was the most significant event in the history of America, or one of the most significant events, I will explain to you why it became that way and the effects of opioids. During the 90s, medicine began its biggest movement yet, pharmaceutical industries. These industries began products and made products that changed the industry, including painkillers. There was painkillers like Advil, Tylenol, Aleve, all these ones that we now know today. And there was better pain management on its way. When it came to intense, ridiculous, I can't control my pain, the increase of medicine began opioid use. Doctors normalized prescribing opioids to their patients when they dealt with continuing or chronic pain. And based on the National Institute of Health and their website, we see how the drug overdose crisis began 40 years ago and how it was driven by drugs like heroin, crack, and cocaine. This quickly spread throughout the nation because, number one, it was managed poorly by doctors in the medical community. And these prescriptions began to be flooded within pharmacies. And soon, patients were addicted to these opioids. Because of these widely used drugs, synthetic opioids started to overtake the market. Drugs like fentanyl or Oxycontin began to cause severe accidents that would lead people to hospitals, or even worse, there would be overdose deaths. All this led to the overuse and continued use of opioids even now in 2025. People still use opioids. And according to the CDC, or the Department of Center Department of Control and Disease, more than 217 people die each day from opioid overdose. Second, I will talk about this timeline, right? How it became in the 90s and how it's had a rippling effect even now in 2025. Although it became very known in the late 1990s, it had its ultimate peak in 2010. According to the CDC, heroin was the cause of overdose deaths during this time. But we can also see how it began then again. The third wave began in 2013, where synthetic opioids began, although this time there were illegal drugs. And these are the three waves we see of the opioid crisis. Nowadays, we see how opioids can be seen as small pills or they can be in powder, but there are also stimulants that are mixed within drugs and they're on the rise on the streets of America. And these are causing new threats to communities, and they continue to show even when we don't look for them. And my second point, I talked about the timeline, which leads us to today in 2025. Although there was an opioid crisis, it continues to carry on. The worst has passed, the worst of the consequences have passed, but people are still using them, and there's misuse, there's disorders, and there are overdoses. This is important to know because according to the National Institute of Health, more than 9 million Americans ages 12 and older misuse opioids just in this past year. And more than 5.5 million people in America live with chronic pain and and just overall pain every day. And this affects their daily life. Pain management is necessary, but there are different strategies that can be accessible. Um, yeah, as we've seen, there are severe consequences of this epidemic and what started it, and how many people had to deal with and have to deal with chronic pain. Now you know a little bit more about the opioid epidemic and the opioid crisis and how it's created such a big gap and destruction for the lives of many people. I first talked about what it consisted of and how addiction affects thousands of people. Then I talked about its timeline. And third, I talked about how we still see it today. So maybe remember that opioids aren't just statistics or history. And although we read that it happened long ago, it now affects us today, our communities across America. And the more we understand it, the more we can be informed and support preventions. Thank you.